Hello to all of our quality-minded listeners, and a special shout out to our Mayo Clinic Care Network members. Welcome to Key into Quality, a Mayo Clinic podcast focusing on healthcare quality and experience. I'm your host, Dr. Tim Morgenthaler, a professor of medicine at the Mayo Clinic and vice chair of Mayo Clinic Quality. And I'm excited to have as our guest today an industrial hygienist in our staff safety unit, playing a pivotal role in our mission to keep patients, visitors, and coworkers safe within the healthcare environment. Co-hosting with me today is Sherry Nemec. Sherry?
Welcome to everyone joining us today. I'm Sherry Nemec, Consultation Relationship Manager for Quality at Mayo Clinic. I think this is a topic that you don't really think about when you go to work, especially me in quality, right? I'm not doing direct patient care, but I'm really not thinking about, is my environment safe, right? I'm
Yeah,
just assuming that it's safe for me to work in. But there are a lot of people putting a lot of effort in behind the scenes to make sure that's true.
this is one of these podcasts or discussions that when you're done with it, you're going to think about your workplace a little differently, I think.
I think so.
We've talked a lot about safety on this podcast, mostly patient safety, but as we've said before, we believe that safety in healthcare really shouldn't have an adjective. It's just safety. And we need to engage everyone at work and every discipline to really achieve the high levels of safety that we want. Industrial hygiene in healthcare is essential due to the unique combination of hazards present at a place like Mayo Clinic or your hospital at home. And this ranges from chemical exposures and airborne pathogens to ergonomic challenges and noise levels. You just don't know what's all out there. So today we're going to learn about how our guests' work contributes to workplace hazard reduction and medical surveillance. I think we're all going to be surprised to learn about the wide varieties of hazards in a hospital, a clinic, or a laboratory. Yeah, I mean,
Hmm.
we need experts in this area because I certainly don't know. I don't even recognize them
No,
until
right?
probably it could be too late. So I'm really glad. So now let's get started as we explore this vital role of the discipline of industrial hygiene in maintaining a safe place to practice what otherwise we think of as the art of healing. So our guest today is Jeff Nesbitt, supervisor of industrial hygiene at Mayo Clinic in Rochester. Jeff, welcome to our podcast.
Yeah, welcome, Jeff.
Thanks for having me today. Appreciate it.
Well, I hope I didn't tell too many stories, but why don't you tell us a story about yourself? Tell us about yourself and your role in industrial hygiene at Mayo Clinic. I mean, how did you get here and end up doing what you're doing?
Well, I've been here quite a while, 24 years. I came here, my second job after an undergrad degree in occupational safety and environmental health. I went to graduate school shortly after joining Mayo Clinic, and I've been here ever since. I started right out of college in working with heavy industry, construction, chemical processing, and some environmental remediation. And a position opened up at Mayo Clinic, and it was fascinating. And that's when I took the big step and joined Mayo, and I've loved it ever since.
Well, we're so
Wow.
glad that you've spent all those years with us and getting
Yeah.
your expertise in this space. I know we all benefit from it. Can you talk a little bit about industrial hygiene within the regulatory framework? That's just an area I don't know anything about. So, love to hear you share on that.
Sure thing. So I think we've all heard about the regulatory side. We've heard of OSHA is one of the primary regulators in that space. And when we talk about OSHA, there's a lot of safety engineers, safety specialists, safety generalists, and that's the occupational side, but it's occupational safety and health administration. When we think of the health side, those are their industrial hygienists. So they deal more in the heat, the chemicals, the noise, more of the, when you don't think of electrocution or falls or machine guarding, kind of the traditional safety items, a lot of those fall into the industrial hygiene field.
Jeff, before we go further into this journey that you've had with Mayo Clinic, I'll bet a lot of our listeners, and myself included, I don't know a lot about industrial hygiene. I mean, what would be the field of industrial hygiene?
What really defines it is it's the anticipation, recognition, and evaluation and control of workplace hazards or workplace stressors. That's really the gist of industrial hygiene. We work a lot on trying to identify hazards and then quantify them. Once we quantify them, we can look at, is that exposure acceptable or not? A lot of that is in, for instance, the heat or the noise or chemical field. There are acceptable exposures all employees can be exposed to. So it's really looking at those, trying to quantify as best possible, and then making sure that the activities, the work that's occurring is safe and within acceptable practices.
I sort of prefaced our conversation by saying I think we're all going to learn a little bit about what type of hazards are in our medical workspaces. Share a little bit of that with us. You've mapped out for us what industrial hygiene concerns itself with. What's going on in my workplace here that I should be worried about, or better yet, that you can be worried for me?
Well, that's a great question. And I have this with colleagues at conferences and meetings and other things. They think of Mayo Clinic, they think of a hospital, a patient care room, for example. But Mayo Clinic is almost like a municipality to make the hospital space run. We have power plants, we have a waste incinerator, we have many, many maintenance and operation spaces that aren't traditional healthcare looking spaces. They look more industrial. We have large laboratory facilities, clinical and research laboratory, and all of those have unique hazards and strategies to remediate those risks and kind of prevent injury.
You know, when you say laboratories, I mean, I'm thinking about not everyone who's listening here necessarily has research laboratories, but here at Mayo Clinic and many other academic medical centers, of course, you've got your clinical laboratories that are running your blood tests and spinal fluid tests and stuff like that. But there's also research laboratories around our campus here. And if I'm not mistaken, they end up using a lot of, let's just say, a very wide variety of chemical substances and so forth, and biological substances. Is that something that you, in your work, have to keep track of and work with?
Absolutely. Kind of the primary plan we use to help that environment is called the chemical hygiene plan. That's a unique plan that looks at a laboratory environment. So just like you said, a laboratory environment has lots of stuff, a large diversity of chemicals, different hazards, but not large production. So it's different than what we see out in the world in normal industry. And that plan, the chemical hygiene plan, and that's something every laboratory really needs to have. That addresses how we control things, what are safe practices, what aren't safe practices, how do we control things. We have a lot of chemical fume hoods you see as you walk through a clinical or research laboratories at Mayo. You will see a lot of ventilation controls, chemical fume hoods that really we have to use to keep our people safe.
Yeah.
Those are engineering controls that you've discussed, you know, hoods and so forth. The engineering controls are, you know, can be forcing functions, but they can also be things that can be used if people decide to use them. I mean, is there a lot of training of individuals that also falls within your purview as an industrial hygienist at Mayo Clinic?
Absolutely. One of the largest areas, not just industrial hygiene, but staff safety, one of the largest family of modules we have at Mayo is in staff safety. A lot of those are related to industrial hygiene matters. For example, we have hazardous substances trainings that anybody who routinely works with a chemical at Mayo Clinic needs to take. We have, such as the engineering control you mentioned, chemical fume hoods. There is a module on how to use a chemical fume hood safely, and on down the line. Many topics, any program areas that you can think of where it's a significant hazard, there's probably an education module to address that, as well as support if you have questions. We welcome and ask that you reach out to us and we can help try and answer those questions.
Now, some of those I can more easily envision again in kind of laboratory settings. Are there some that are similar, let's say, in the hospital setting?
Yes, I think there's a lot of hazards and controls in the hospital setting. I don't specifically work with a very significant one in the hospital is patient transfers, patient lifts. That's an extremely important one. I guess that's not my field of expertise, but there are a number of people that work very hard every day on that topic here.
Yeah, we did get a chance to do a podcast not long ago with ergonomics
Yes.
person that's also in staff safety in that area. And so that was a very interesting conversation. Dr. Morgenthaler and I have been talking with people as well recently about high reliability and HROs. So curious about if there's a model or framework that helps guide your work.
Yes, there are various models that help us. You know, I talked about the industrial hygiene, what it is, the industrial hygiene model we just talked about. That's that anticipation, recognition, evaluation, control. That model really feeds another control mechanism that we deal with day in and day out, and that's a hierarchy of controls. I think we've touched on it already, but every hazard we see, we run it through this model. First, if we see a hazard, workplace hazard, we try to eliminate it. Is there a way, you know, use that example of a patient or a chemical in a laboratory? Can we eliminate that? Well, in a lot of cases we can't. Sometimes you can, but if we can't, can we substitute it for a safer product, a safer chemical, safer practice? If either of those don't work, we can move to engineering controls, such as a chemical fume hood. So as we go down this hierarchy, it becomes less and less effective. If we can't engineer it out, have an engineering control, we can move to administrative controls. An example of that is common in, say, noise or heat, where the hazard is here. You may not be able to work your whole day in a high noise or a high heat environment. You may only work portions of a day or portions of an hour. And finally, one that all of our colleagues are familiar with is personal protective equipment. So oftentimes we go through this hierarchy and we just cannot solve the problem. And we need to put people in personal protective equipment, or there is some residual risk where we've done a lot of these things, but there still is some. We may have exposure to some infectious pathogens, infectious aerosol, and we have to put people in respiratory protection, for example. That hierarchy is really how we look at and we approach every workplace hazard and work it through that hierarchy.
So I imagine over time you encounter these problems, and of course there's new hazards that come into the environment all the time as somebody thinks of a new process or new test they want to do or a new gadget that they have or something. So you have to constantly be looking at these things. I imagine it's iterative, and we would call that quality improvement. Do you have any quality improvement stories that you can share?
A few. One example is a few years back, we had a regulatory change. So that was the U.S. adopted the globally harmonized system of labeling and classification of hazardous chemicals. So that was a big deal. The world, we came together and we started labeling things the same, classifying the hazards of products the same, maybe not exactly the same, but similarly across our industry trading partners across different countries. And that really set the stage for similar taxonomy. Now, depending where you're at, we really can do a lot better job communicating hazards to our workforce. We have this similar taxonomy of hazards. So the manufacturers and distributors who make this stuff now are on the hook to classify it in the standardized taxonomy and then communicate it to all of us as end users. So now we have some power in that understanding the hazards we're exposed to. So at Mayo, we utilized an online chemical inventory management system. So now if you come in, you work in a patient care area or laboratory, you really need to have your chemical inventory up to date. We have a vendor partner then that looks at every product that comes through our doors and assigns those classification, those standardized classifications. And then that feeds all of our regulatory reporting, our hazard communication requirements to our staff. It helps with education. So that has really set the stage for a lot of improvements over the last decade in the US and specifically at Mayo. We've worked through that framework to identify really the worst case products that we get through our doors and maybe the top 1%, 2% of products that really we have to pay special attention to that have unique hazards to our workforce. And those are all reviewed, and we have the end users or the proponents look at those and submit an application, and it's reviewed by the Hazardous Chemical Management Committee at Mayo. That protocol is reviewed, and that committee may say, well, this is great, or let's look over here. We need some better engineering controls, different training, different practices. Can we, in that hierarchy of controls, can we substitute it for less hazard? And it's really a committee of peers. There's scientists, there's practitioners, and others on that. And it's really been a success story to reduce the extremely hazardous products we have at Mayo Clinic. I would say that's a huge one.
Sounds like a huge lift. Just give us a sense, if you can even ballpark it. How many products are we talking about in that inventory?
Well, at Mayo, we have about 60,000 unique chemical products.
Wow.
It may be the same product from two different chemical manufacturers, though. So it may not be, but it's a unique safety data sheet that comes from three different manufacturers for the same product. But there's about 60,000 of those. And of that, there's under 1,000 that we would call unique, extremely hazardous or highly regulated.
Boy, that's
Wow.
still a lot to manage, though.
I was just thinking, so on the clinical side, I just came from a division meeting that happened earlier today, and sort of the theme of the meeting as we discussed things were medical practice is changing so fast that we are having a hard time getting our hands around the new tools that are coming into our hands. How do we learn them? How do we use them? How does it actually help us, or does it not help us? So medicine and healthcare are changing very rapidly. Are there industry changes that are impacting your work and how you're approaching them?
There are, and it seems to be accelerating. Like the example earlier, we now, maybe a decade ago, partnered with an outside vendor to do this classification of all of our products. It just grew too large to do in-house, and it would have had to been redone based on the new rules. So that's one example. But we have these unique challenges that are coming. A few years back, there was industry changes. There was really a ban for all practical purposes on mercury. So we had to create a way to get rid of the mercury and keep some of those mercury products that were essential to patient care on campus. So we really had to work through that mercury ban. And now, today, we're working through a proposed ban by the EPA on methylene chloride. That's going to come into effect in May of 2025. And we use that in laboratories, in our facilities, and it's quite a deal. It's very hard. We'll be in good shape by May, but there's a lot of work to be done between now and then. And it accelerates, I think, with time, the regulatory landscape and the expectation that there is of us.
When one of these comes into, I'm just kind of thinking, my mind's back on your mercury example. I'm thinking two things. One of them, I'm thinking, well, mercury used to be in every thermometer around campus. And actually, I remember a time when in my clinic office, the manometer actually had mercury in it, pretty large volumes of it, actually. So where is mercury still needed in the clinical space? I'm sure there's some esoteric laboratory space where you need to use mercury, but in the clinical spaces, where is mercury still needed?
I believe all of the elemental mercury in the devices like you talked about, I think they're all gone off the top of my head. However, I think there's some thimerosal, some preservatives still in diagnostic tests that cannot be replaced at this time. They're validated for that, and they're going to remain for the time being.
Often what's happened is there's a chemical substance out there, or let's say a piece of equipment or something that's just kind of been in use, and people become aware that, hey, this is actually really pretty hazardous. I'm thinking of mercury. How do you go about finding all the mercury and across a big organization to get it out of there?
Absolutely. One tool that we talked about is our in-house chemical management system. If your inventory is up to date, we can find it all. There's reporting tools to find it. If, for instance, as an example, there is articles or products that you wouldn't normally put on your chemical inventory, like a mercury switch in a power plant, those are more of a hands-on, tactile, talking with the leaders, talking with the people, talking really through our safety committees. And that's another thing that Mayo Clinic is unique with. We have, just in Rochester, over 20 departmental-led safety committees that they are our eyes, ears, and our feedback mechanism in lots of cases. And they're just fantastic people who volunteer their time to do this hazard anticipation, recognition, and control, and come up with best practices. And they can do things just like that, as identifying, hey, we do have mercury switches, or we have mercury containing products and other hazards. So that's a fantastic resource that we're blessed with at Mayo.
Agree. It's certainly a high priority, and putting those resources and committees in place to do the work. Let's say that I'm a leader in a hospital healthcare organization, and we have some basic things in this space, but we're really looking to maybe advance our work in this area. How might you advise them to get started, or things to think about?
That's a great topic, Sherry. I think one observation I have, and I've talked to my peers at other organizations similar to Mayo, and industrial hygiene or industrial hygienists really haven't been recognized broadly in healthcare. You may have a safety manager, you may have an environmental manager, you may have a sustainability effort, but industrial hygiene has kind of been ignored in smaller, mid-sized healthcare organizations. And really, there is some value in bringing industrial hygienists to that to help with managing these exposures, because just because they're not recognized doesn't mean they're not there. We have noise-induced hearing loss in lots of facilities, not necessarily just healthcare, but that need to be controlled. We have heat stress hazards, we have chemical exposures. All of these things, they're not going to be controlled appropriately until they're recognized that they're there in the first place. So I think industrial hygiene really has a role in healthcare that hasn't been there necessarily broadly in the past. I think there's some recognition in more recent years, but it's slow progress, I think.
Jeff, that makes me wonder, how many industrial hygienists are currently employed in healthcare, do you think? I mean, maybe that's too difficult of a question. But I mean, like, who do you go to meetings with? Are there meetings of industrial hygienists in healthcare?
One group that I'm active in is the American Industrial Hygiene Association has a healthcare working group. In that group, there are a few hundred industrial hygienists around the country that are active, that volunteer their time to help with more broad consensus-based items and kind of spread the word about the various hazards and that are coming down. I'd say, there's a few hundred that are active in that organization.
Mm-hmm. So if you're a smaller organization and you have received a notification about hazardous substance or some new thing, they could potentially find an industrial hygienist to turn to for consultation if they don't happen to have that on their staff.
Yeah, absolutely. And the one resource I talked about, American Industrial Hygiene Association, does have a consultants listing. So that's very easy, because there's consultants in just about every state. That would be a simple phone call. There's others such as AIHA or the American Society of Safety Professionals. They do have some triaging. You can send some questions and they may give you some response back on, is it very simple? They could answer it, or point you to a consultant in your area that could help answer those questions, or do an on-site assessment.
So Jeff, I know that your work is improving the safety of where I work and where Sherry works, and therefore I think it does improve patient safety and visitor safety. Well, Jeff, thanks so much for just donating your time here to have this discussion. I think this is an important topic, and many healthcare organizations probably don't think about this as part of their quest for safety and not just patient safety. So I really want to express gratitude for the time you've spent with us. I want to thank you for what you do for Mayo Clinic and for keeping me safe as I walk in and out of our buildings and spaces every day. I've worked here about the same amount of time that you have, so I'm really grateful to you for that.
Thank you very much. I appreciate
Thanks,
it.
Jeff. Appreciate having you today.
Yeah. And then to our listeners, thanks so much for joining us. A big thank you to Jeff for sharing his awesome insights into industrial hygiene in healthcare. We've had a great discussion today about how keeping our visitors, patients, and staff safe is really a team effort, and it takes a culture where we can all recognize and respect each other's expertise and work together, sometimes reaching outside of the rigid, here are the clinic staff together. So to everyone listening, why not think about what you can do to boost safety in your hospital, office, clinic, or lab, whether it's keeping an eye out for potential hazards, jumping into safety training, or backing up your coworkers in safety initiatives. Every little bit can help. So let's work together to make our workplaces safer for everyone. Thanks again for listening. Let's keep safety front and center in everything that we do. Mayo Clinic's Key into Quality podcast aims to highlight some first steps in addressing important quality challenges in your organization. Our goal is to improve quality for patients and the populations that we all serve. If you enjoyed this podcast, leave us a review on Apple Podcasts, a rating on Spotify, or feedback wherever you listen. You can also follow us on your favorite podcast platform. Let others know about the podcast so the information can be spread. Until next time, thank you.